I Hate Politics is a podcast dedicated to exploring a human activity we love to hate. We look at human life, culture, and economics closest to us, in our neighborhoods, workplaces, schools and streets, and in our local governments. Together, we will explore how politics is central to getting things done in societies where we treasure diverse views and preferences. I'm Sunil Dasgupta. I've spent my life studying politics, and I know this. Unless we want to live in a dictatorship or monarchy, we are stuck with politics. Politics is more than Trump, Biden, or elections. It's how we fix potholes, make our streets safer, where we put our schools, and decide who goes to them. It's about coming together as a community. It's about us. Let's go find those stories. This week's episode borrows its title from Albert Hirschman's famous 1970 book, Exit, Voice, and Loyalty. The book examined how people respond to decline in organizations and groups. We have heard this often, but the pandemic laid bare several inequities in American society, and in so doing put on display organization decline that I think Hirschman was speaking to. The losses in particular in public health and education have been remarkable. The widespread availability of vaccines and the willingness to take them, at least in the mid-Atlantic states, have stemmed some of the decline. But my guest this week, epidemiologist Katie Schenk and elementary school teacher Valerie Coll, speak to the interplay of expressions of discontent or voice and the possibility of being able to leave an organization or group, exit, and how loyalty shapes choices around voice and exit, especially during this pandemic. School teacher Valerie Coll retired from Montgomery County Public Schools after 32 years, prompted in part by the pandemic. Epidemiologist Katie Schenk spent much of the pandemic year underemployed as a volunteer in a public health system that had been in decline for decades. Shank is re-examining how her profession engages in public and political discourse and wants investment and reform in her field. Valerie Coll is planning to run for the school board. Music for this episode comes from Seth Kibel, a Washington DC and Baltimore-based woodwind specialist, music producer, and arranger with an astonishing range from blues and jazz to klezmer and reggae. He performs with several bands, including the Alexandria Klestet, Bay Jazz Project, Music Pilgrim Trio, the Natty Bow, and is the winner of 28 Washington Area Music Awards. Whammies. It's a thing. Check it out. Songs for this episode come mostly from his 2017 album, Seth Kibel Presents Songs of Snark and Despair, which he wrote in response to the 2016 presidential elections. I'll be back with the news roundup. After some victories over the July 4th weekend, some sobering news about the pandemic. COVID cases are up in what is now being called a pandemic of the unvaccinated, of which children under 12-year-olds are a big percentage, especially in the Washington DC region, where vaccination coverage of those over 12 is higher than the national average. Pfizer, which had projected vaccine availability for children under 12 in September, has now pushed back its dates. Schools are set to open in 5 weeks, and parents are once again fretting about safety in schools. In Montgomery County, 3 elementary schools, Burtonsville, Stonegate, and Harmony Hills, have confirmed COVID cases during summer school, and an announcement is waited from a fourth school, William Gibbs Jr. Elementary School. The American Academy of Pediatrics is recommending schools reopen, but also that all students mask inside school buildings. AAP has often taken contrary positions to the CDC, and this is another time. CDC is not recommending masking indoors for vaccinated people, and that includes schools. School closure due to the pandemic has been a politically charged issue. In Fairfax County, a parent group has gathered over 5,000 signatures necessary to start a recall of school board member Elaine Tholen. The recall petition goes to a judge first. Its advocates call it a first of its kind, holding school board members accountable for school closures during the pandemic. Similar petitions target other Fairfax County school board members. It is unclear if one member of the school board can be isolated and punished for the collective decision of the entire body. Governor Hogan pushed forward his plan to add toll lanes to Interstate 270 by engineering a reinstatement of the project in the Washington Metropolitan Council of Governments Transportation Planning Board priority list. The board had previously removed I-270 toll lanes from the regional priority list. Hogan turned leaders from several jurisdictions by tying funding for transportation projects in their counties to the money the toll lanes were going to generate. He argued that without the money from the toll lanes, the state would not have $1.5 billion in investment it had planned to make in transportation projects across the state. The hardest nut to crack was Montgomery County, where County Executive Mark Elrich and other leaders vociferously opposed the plan. Elrich had engineered the earlier Transportation Planning Board vote that removed the toll lanes from the regional priority list. If you're interested in the arguments around the toll lanes, tune back to our June 11th, 2021 episode called Transit versus Tolls. Finally, Hogan turned 5 out of 9 Montgomery County Council members with a promise to build a bus rapid transit system in Upper Montgomery County. The move by council members Hans Reamer, Gabe Albornoz, Andrew Friedson, Nancy Navarro, and Craig Rice sharply divides the political leadership of the county. Council President Tom Hucker, Sidney Katz, Will Joando, and Evan Glass did not sign the letter and remain aligned with County Executive Mark Elrich, who is pushing back on Hogan's toll lane plans. The letter of support written by the 5 council members puts them at odds with Montgomery County state delegation, whose prominent members, including leader Mark Corman, is firmly against the toll lane expansion, distrust the governor's promise to deliver a large transit project in Montgomery County, and discomfited by the private-public partnership underpinning the deal, which hands over toll revenue for the next 50 years to a private firm called Transurban that also runs the Northern Virginia toll lanes. In among his first actions after releasing the county climate action plan, Montgomery County Executive Mark Elrich has proposed legislation to lower the threshold size of buildings legally required to cut emissions from 50,000 square feet to 25,000 square feet. How much emissions will be cut has not been established yet. I'll be back with epidemiologist Katie Schenk. Katie Schenk, welcome to I Hate Politics.
Thank you. It's a privilege to join you.
You have worked in the Washington, DC region throughout the pandemic as an epidemiologist, as a volunteer in different roles. What is your lived experience of that year?
So when the pandemic started, I was teaching public health and global health and epidemiology to students at American University. And at that time, I also realized that my skill set as an epidemiologist was in short supply. So I wanted to volunteer to offer support with my skills to the front line, to the public health front line. So at that time, I signed up to join the Medical Reserve Corps, which is a surge staffing mechanism by which people with appropriate skills can volunteer to serve in their local communities and their local jurisdictions during public health emergencies. And I was very quickly called up to service locally within the Montgomery County Department of Health and Human Services, whereas I was assigned to join the epidemiology team. And I took on a variety of support duties to help managing the new data. There were lots of new data coming in, new test results coming in every day, and the Department of Health and Human Services was struggling to determine its immediate response. It was very early days, and we were all very overwhelmed. At that time, in the early days, I was asked to design a form, a database, to collect data from every individual in the local area who had known to be tested positive for COVID-19, and to ask them questions, a standardized set of questions about what are the risk factors associated with their infection. So we would go through a list of medical risk factors and social risk factors to understand their exposures at that time. And I also spent a lot of time at the local health department processing the new COVID test results, which started to come into the local health department. And they would come in by fax. And at that time, we were really focused on the nursing homes as hubs for the outbreak. We would track the new infections and develop risk mitigation measures for the nursing homes. And I did a lot of work at that time in developing surveillance systems, just so that we could simply count the number of infections among this really vulnerable population resident in congregate settings, which is, as we call, nursing homes and associated types of living situations. And it was really frontline public health work to track and to monitor those local outbreaks in order to work out how to mitigate them during that very first surge of infections that we were seeing in the spring.
What is the data that you were trying to get at that time? What is it that you thought would be important to have so that we can get ahead of the disease?
The earliest form that we had from CDC was asking about international travel, and specifically about travel to China. That was the very earliest iteration of that form, and we were still focused on the early cases. We were developing the next stage after that. But I think that the fact that we were still required to do that at the county level was, to me, the first indication that something was going wrong at a systemic level, beyond Montgomery County, beyond Maryland State, beyond the DMV area. Why were we collecting that? Why was I designing that form at the local level? There's a question in my mind. Why was it any different in Montgomery County than it would be in neighboring PG County, or for that matter, over the border in Fairfax in Virginia?
What is your answer to that?
I think what we needed then was a national form from CDC, and we didn't have it, because at that time CDC was not empowered and was not able to provide that guidance to the states and to the counties. There are also political reasons, and I'm sure that you're more familiar with me than about the need for counties to have independence within the state. But to me, as someone who relies very heavily on being able to understand the data and being able to compare the data across boundaries, it was very important that the form I was designing for Montgomery County should be comparable to the forms of our neighboring counties, should be comparable to the data collected all across the country.
Sure.
So what we really needed at that time, and we didn't have access to, was a uniform system of data collection where we were collecting data that was the same and consistent across those jurisdictional boundaries.
It was hard to get a test at that time. So when you were designing the form, were you designing it for those that were reporting symptoms, or they were reporting tests? Who was this meant for, and how are you getting it out? What was, in effect, how was your form and your surveillance mechanism connected?
The form that we were working on at that time was a form for people who had received a positive test result,
Okay.
not for people who are symptomatic. But you're absolutely right to point out the delays in getting tests and the delays in accessing tests and the subsequent delay in getting test results are a huge factor undermining the effectiveness or the usefulness of any of that data. Mm-hmm. So it wasn't until later on when tests began to become more widely available, and in particular when the test result backlog started to clear, that we could actually get a clearer sense of what was going on in that data. So you're absolutely right to point out that was another systemic weakness that we were dealing with.
And faxes, right?
So healthcare providers can only transmit lab reports electronically if they've purchased the rights to an electronic lab report system, or they have some kind of encryption software, which again, they have to purchase. And these things are expensive. So mostly a lot of the small labs and many of the small ones that were popping up really in response to COVID didn't yet have or couldn't afford to have access to the electronic transmission software. So instead they were choosing to send results by fax, which is cheap, which is secure. And then the content of what they were faxing was non-standardized too. It might be a copy of an electronic medical record. It might be handwritten notes from a doctor. It might be totally illegible. It might be totally non-standard. I had one county who was sending me totally, they had their own specially developed code, but they didn't provide me with a key for interpreting their results. So each county, each state was doing it in their own particular preciously special way. And it took a while to understand, to interpret, and to standardize that method of sharing test results. So I think what I'm trying to point out is that when you see these fancy, slick data dashboards all over the web, and you say they look like they're tracking infections in real time, and you see a clock ticking away and numbers going up, you have to think, really, what are they counting? They're looking at data that really is giving the impression that it's something up to date and modern, but it's relying on a really creaky and old-fashioned system, which requires not just a fax machine, but a whole round of double data entry that's happening by hand, all of which takes up time and introduces a possibility of errors. And then if we discover in the process of double entering the data that we've got the resident of a different jurisdiction, then we have to start all over again, sharing data with a different location and transferring the test results to them. So this very localized record keeping system is a huge weakness of the system that we really need to overcome and to modernize the system in order to deal with not just with COVID, but all the health challenges in our future.
What is the substantive result of all of that? Where do you think we failed?
Well, there's obviously a systemic error here in the data modernization process. Public health, when the systems work well, you don't notice them. You take them for granted. And there are a lot of elements of the public health system that have been quietly functioning in the background for a while. We don't tend to talk that often about, routine childhood immunizations anymore. We only notice it when there's a problem. If they've achieved wide coverage, that's great. So to a very high degree, the prevalence of communicable diseases of childhood the prevalence is very low in this country, more or less, most of the time. You notice it when there's a localized uptick, when there's a sudden outbreak of measles. There's a problem, you need addressing it. Public health has been ticking along very nicely with those systems in the background. We just got stuck. We got stuck at a point where we were ticking along very nicely 40 years ago, and we never updated the system. And there were no new investments in infrastructure. And so suddenly, when COVID comes along and upsets the boat here, suddenly we've got to consider processes like how are we going to conduct genomic sequencing? We need to explore which variants of the coronavirus are most prevalent in the United States or in specific areas. It suddenly becomes apparent that it's not just the laboratory infrastructure that's lacking. More importantly, I would say it's the human capacity. It's the expertise that is lacking. And I place a lot of emphasis here on the lack of investment in human resources for public health. It's been a very undervalued skill set for many years. And we sort of, as I said, we tick along quietly in the background, but no one really knows what we do. For most of my career, if I've said that I'm an epidemiologist, people think I'm a skin doctor. No, I study the spread of disease. So I remain very concerned that we're not doing everything possible now to build and to reinforce the public health workforce. The two different ways in which I've been working during this pandemic are through what I've called surge staffing mechanisms, so sort of discrete ways of pulling in staff to places where they're temporarily needed a lot. One was through volunteer work, and one was through a nonprofit agency that I was working for at a different jurisdiction. But they're both temporary mechanisms that were put into place to respond to the immediate need of the emergency. They've been praised for being nimble, which is true, but what we really need is long-term sustainable funding to build up the public health workforce in not just a sustainable way, but a skilled way. We need to make sure that the skills are getting where they need to go. And the White House has recently announced new funding that's going to go into the building the public health workforce through the American Rescue Plan. I think they've allocated around $7.4 billion, in fact, to train and support public health workers. And they're making huge efforts to make sure that that new workforce is going to be reflective of community diversity. All of this is a great start. But the public health workforce has been lacking for so long, and it is so remarkably depleted that we really need some radical moves to rebuild and to reshape the entire public health system, to strengthen the capacity of local and community groups and state health departments, and to establish new partnerships and build a stronger, more capable technical workforce so that we public health workers can do what we do to ensure that we all live safer and healthier lives.
So, Katie, the problems you identify, lack of coordination, good data management practices, the lack of having the right people and the right places, these are problems that have been identified, for example, by the 9/11 Commission about the September 11th attacks on the United States in 2001. Um, is public health different from other issue areas in this respect, in your view?
I think it's a really interesting analogy. I think it's very clear that it's not until the disaster event has already happened and exposed the weaknesses in the system that we start to gain any widespread understanding of what we've lost and how important it would have been to safeguard against it. The analogy that kept coming up during the early days of the pandemic was, we're building the plane while flying it. Or as some of my colleagues would adapt it, they would say we're building the plane while crashing it, right, because it was so apparent that we were failing to do the job that we were doing at the beginning. The more I think about it and the more I stand by the fax machine, for example, the more frustrated I get that we've not been able to modernize and to innovate within the system. We are trapped by the system that has worked for 40 years and we're not ready to modernize it. Now that the money is coming in, we're not well placed to absorb it, frankly. I'd like to know what we're going to do to bring these rickety old public health systems up to date and bring into the 21st century the ways in which we communicate, the ways in which we share data. There's a question here about the ways in which we use data, and I think I see that a lot when I work with people in other areas of my job from the private sector who come into some of the consulting companies who are coming in to work with local government or state government at different levels to take on specific consulting tasks that the government departments, the health departments don't have the capacity to do. So they contract with the consulting companies to do those kinds of jobs. And when I work in close cooperation with them, there's a real culture clash between the private sector and the public sector people who start to work together. And I'm learning a lot from that dialogue. And I think what's happened is that public health has been starved of funding for so long that innovation and being able to respond nimbly to problems and are just no longer internal strengths within the public health system. And I have found myself learning a lot from my colleagues in the private sector. And I think it's really important that we start to learn to work with experts in our field and to recognize our comparative advantages. Perhaps we can develop more public-private partnerships to learn from each other and find our respective strengths in order to counteract the long-term and the chronic underinvestment, to figure out what it would look like, for example, to harness the power of big data for public health. Likely, I'm guessing it means that many of our government departments or public health departments don't have those specific capacities in-house already. So I'd like to suggest that partnerships and external relationships should come into play here, and as we explore those capacities and we develop them into establishing those capacities in-house long-term. But we're going to need some transitional measures, and I really want to encourage innovation, because right now public health staff within local and state governments, the ones that I see, are so stretched and strapped, they don't have a minute free to innovate and to explore and to experiment. They have to stick with what they do and what they know, because that's the way they've done it for 40 years. We really need to build a new and innovative system to get us to a better place.
Are you optimistic going forward about a rejuvenated public health system, or public health as a discipline?
But now is the time to be optimistic, if any. I work at vaccine clinics throughout Montgomery County, and I'm standing at the door welcoming people into the vaccine clinic, people from all walks of life. I really have started to understand the true meaning of diversity when I see the people who are, if people are starting to become aware of the role of public health in everyday life, if that message is really getting out there, then I really hope from there we can leverage and lobby for more investment in public health in terms of infrastructure, in terms of jobs, in terms of data modernization, and all of the pillars that are needed by a fully functional public health system.
If you were standing in vaccination clinics welcoming people, then it seems to me incredibly that you are underemployed. You should be hustling, bringing about the systemic changes that you're talking about, but instead, you're standing welcoming folks into a vaccination clinic.
Yes, I absolutely feel underemployed. I'm effectively a very friendly, knowledgeable receptionist standing at the front of a vaccine clinic. I answer people's questions, I talk to people, I welcome them, I check their paperwork. I'm completely overqualified for that job, but I love doing it and I'm happy to do it as a volunteer. You're right, the reason I'm doing it is because I'm underemployed. I am qualified to work in infectious disease epidemics and there isn't a job for me right now. This is the problem. You're absolutely right to point that out. And until that resolves itself, I will continue to volunteer in vaccine clinics.
Okay, so let me ask you this. What is the problem getting a job in infectious disease? Where is the holdup? There are not jobs available. You are not qualified for them. How is that?
At the moment, the money that the White House has earmarked for jobs, expanding the public health workforce, has not filtered down to the actual creation of jobs. We're 14 months into the epidemic now, and we're not really seeing the creation of new jobs.
So more public health workers, more public health work, especially at the senior levels, have not been hired all during the pandemic.
That's my personal experience, yes. I would say that there have been lots of temporary mechanisms by which contact tracers and community health workers have been hired. And I've certainly worked very closely with some of those people and been very impressed by the jobs that they do. But these are short-term, finite, discrete funding mechanisms that do not establish public health careers for any of those people.
That's just amazing.
It's a
it
systemic weakness
is
of the system.
mind-blowing.
Little twist to my family's story, and my family have had a particularly rough ride during this epidemic, and we've experienced loss, and we've experienced grief, and we've experienced mourning and the loss of community. But when I brought my daughter into that vaccine clinic, it really began to feel like we were turning a corner. And the person who vaccinated my daughter turned out to be the doctor who delivered her at her birth.
Wow.
Because my former OBGYN who delivered her was retired and volunteering at my clinic. So it was a really beautiful and poetic kind of life cycle moment for my family to recognize. For us, we're hoping it will be a new beginning for our family to begin to emerge from our period of grief and mourning and isolation, and to begin a new chapter of working to really end the effects of this pandemic.
Katie Schenk, thank you for coming on I Hate Politics. I'll be back with elementary school teacher Valerie Coll. Valerie Coll, welcome to I Hate Politics.
I am so happy to be with you, Sunil. Thank you for the invitation.
You retired from MCPS after the pandemic here. Did the pandemic have anything to do with it, or were you planning to retire anyway?
Well, I had been planning to start thinking actively about retiring, but the pandemic really did, along with other issues regarding people's health in my family, just made me realize that now would be a good time to put this into motion and to sort of put a put a happy face smile on the end of 32 years with the county.
32 years, that's a long time.
But I don't age, so that works for me.
Tell me where you started. How did it all begin?
I guess I'll start a little bit before my 32 years. I was working. I grew up in Boston, lived in the Boston area my whole beginning part of my life. And I was at work one day, and I worked at a lecture agency, and it was the day the Challenger blew up. And I remember going into our conference room, the news was on, and going into the conference room to the TV that was in the office, and being just, horrified as we were, but also thinking to themselves, every single one of the people that were on that mission knew the potential danger of doing that. And none of them would have traded places with anyone else. That was where they wanted to be. That was the moment in time. That was the work they felt they had to do. And in my head, and I looked at what I was doing, and I thought, are you doing what you want to do? Are you doing what you're supposed to be doing? And people had always told me, you would be a great teacher. You should teach. And I was like, ugh, no, thanks. No, that sounds awful. And I realized on that day that I needed to get back to school. And I went back to school at UMass Boston and got my teaching degree. And at the end of getting my teaching degree, applied for jobs and ended up here in Montgomery County.
This is interesting. So people told you that teaching is awful, and still you went into it?
No, I thought teaching sounded awful. I was like, it's so much work. There's so much responsibility. It seems like, just the weight of what the job meant, and people I knew that were teachers, how much work they did, and it was nonstop, but they loved it. And they always said, you would be a great teacher. And I thought, I don't think I can do that. And realizing that, what, that's really what you're supposed to be doing, dummy. Go back to school and do what you're supposed to do.
So in 32 years, did you come up with any conclusion about whether teaching is as awful as you thought in the beginning?
There are completely terrible parts to it. And they are the parts that go right to sort of the heart of sometimes of what we talk about, and what you certainly talk about all the time. The politics of it can be some of the worst about it with education. The absolute best part is when you're teaching. When you're in that classroom and you're with kids, and as a teacher, you know this too, when you are helping somebody ask a good question, when you're helping somebody process a concern, or to get them past a roadblock that they've got, when you're helping somebody expand on an idea that they're like, wait, and yeah, they come up with something, and you're like, yep, keep going with that. How do you encourage that? How do you build that? How do you grow it? That's the absolute best part of the job. There's nothing like walking through a building in the morning when it's quiet. I'm usually one of the first people to arrive. I'm kind of that early person. If I get it done in the morning, that's great, because I'm usually brain dead by 5 or 6 o'clock at night. And going in and hearing the quiet, and then hearing the sound of a day build as more people come in, as dialogue between, teachers is happening. Maybe there's a parent conference, there's phone calls, there's announcements, the sort of roar, the tsunami of kids coming up the stairs in the morning, and responding to whatever mood comes in the classroom that day out of the 20 to 30 bodies that are in front of you, and being able to juggle that and work with all of the different parts, and how a day is never the same, is just absolutely glorious. It's the best feeling in the world to get to the end of the day, and when you wave the last one out the door, to think that was a great day. Even when, even if something happened that you had to sort of handle, but at the end of the day, you did everything you could to the best of your ability to just get those kids through one more day of learning, and to help them along the path. It's just the greatest job in the world.
I'd imagine that most jobs have this quality to them that there are really some crappy parts to them, and then there are these enriching, rewarding parts to them. I'd imagine that your description will fit a doctor's life. But we have a retention problem in teaching. We also have a retention problem with medical professionals. But do you have a sense of why there is a retention problem with teachers?
I think the key difference is everybody understands when I go to a doctor, as much as I might go to WebMD or God knows what else and have diagnosed myself with a million different ways, I need the doctor. I need that expertise. I need somebody with that skill to be able to help me process and reflect and figure out, what my needs are. When people walk into a classroom, unfortunately, there are too many people who walk into classrooms or have a perspective of knowing everything they know about knowing everything about education simply because they have been through school. And there is a great difference between having been processed through school and accepting the sort of awesome responsibility of what it means to do the job. And every child that comes to you is sent to you with and I believe this, every parent sends you their best, right? That's the key. You know that every time a parent sends their child to school, they send you the best that they can of their child that day, and they put that trust in you to do it. Unfortunately, there are situations where you come into conflict because somebody then judges whether or not your best is actually what they think is the best for their child. And that's hard for newer teachers. That idea that somebody could misperceive or have the feeling that I know how hard I'm working to make sure that you're being successful. And if you come in and we're having a conference about Sunil, and your mom says to me, well, I don't think that you're doing the right thing. If I say, well, help me to understand, how can I best help him? There are some situations where people say, you figure it out, you're the professional. That's a really hard thing for some people to process. That's a difficulty about retaining teachers after a while. The amount of hours that it takes beyond, say, what we would consider a duty day. And the specious argument, well, you have summers off, when you truly don't, in most counties around the world. And you also you're not paid. So that's another thing, like the amount of work and the compressed time, the demands of a system, especially a system like MCPS, which has because of its sheer size, the systemic pressures of classroom performance and assessment and reflection, as well as sort of all the administrivia that goes along with what a large system demands, become overwhelming. And just simply the sort of anguish it is, because there are much easier ways to earn a living. And to do this job, you have to really be committed, and be committed fully to the fact that there's a personal cost to it. You'll have nights where your mind is racing because that one kid, something happened, and you're working so hard trying to process, how do I make that better? Where, how can I help? Where did it go off the rails? Or what are they showing me, and how can I build them up? Just the psychic toll of the job. It's not something you put aside at the end of the day. There are a lot of jobs that have a lot of pressures and demands, but once I complete my task, that task is done. It is submitted. I can walk away from it. It is now somebody else's job to handle that part of the work, and I move on to my next task. Just the human factor of the daily interactions with so many kids, whether they're elementary kids, the pre-K kids, all the way up through the high school kids, and the disparity of need, emotional need, academic need, social need that all of the kids come with, and they are yours.
That's interesting. the same thing that makes teaching rewarding, which are the relationships with
Mm.
students, is also what makes it truly taxing having these relationships with 20, 30,
It's a
or even
vicious
more
cycle,
students.
Sunil.
So, what is the way, what is the solution here? Perhaps a better question is, we used to be able to do this
Mhm.
better earlier, and now the retention problem is getting worse and worse.
And don't forget that years ago, the reason you had a stable amount of a teaching force is because education has primarily been a female-driven workforce. And so as a primarily female-driven workforce, um, particularly at the elementary level, where you have the bulk of your teachers, most of the teachers that are employed by the county are at the elementary school level. Um, you and our numbers at elementary are something like 93, 94% female, not in administration, but in the classroom, which is another kind of funny disconnect sometimes. But when you're talking about young women who have the world open to them, right? There are so many careers that are out there. People are no longer defined by female, and that's good, right? We want genderless employment. We want employment to be whatever it is for the person who's best qualified to do the job. So you'll have a lot of women that traditionally may have thought of education as a good option. But over the years, particularly with the amount of standardized testing, with the amount of administrivia that is now a part of jobs in elementary school, that wasn't a part of it as much years ago, that alone, and for the amount of pay you get with the level of education that you are expected to also achieve and maintain, where other jobs you can get your job and you don't have to continue to go to school, but that there is a call for you to maintain it, and you have to maintain ongoing professional education. There are better ways to make a living, better ways to make a living, in terms of your salary, in terms of that less taxing emotional tie, and in terms of having a better work. And one of the things that we've heard so much over the past year that the pandemic has really brought into focus, that work-life balance, that work and home personal life balance. So that's hard.
That's a very astute and insightful observation that more opportunities for women in the larger economy has led to a retention problem in the teaching profession. But I do want to talk about gender imbalance. A little while ago, I think you implied that teaching lacks respect. Do you think it has to do with the fact that women constitute most of our teaching workforce?
I don't know who probably said it first, but I'm imagining it is in a male voice. Those who can do, those who can't teach. I just and I may be completely wrong about that, but somebody can, please feel free to contact Sunil and prove me wrong. The the idea of the gender bias of it, I think, does come into play. Um, Look at it when you particularly when you go up towards middle and high school, right? A lot of times you'll see, and again, I think we're getting better at it because I think people are more aware of it and understand, and I think that's all to everybody's benefit. But traditionally, in the past, if you were looking at um, positions like department chairs in high schools or in middle schools, or certain resource teacher positions, that those were traditionally, because they were seen as leadership positions, were more likely to go to, if there was a male teacher available, to a male teacher. Um, Simply because then it traditionally also, those were, and again, were roles that were seen to be along the pipeline of leading into administration, right? When you look at the number of principals and leadership that have been traditionally within the county, many more male voices at the table than female voices. One of the things that I think is very powerful is when you look at the Board of Education right now, with the new inculcation of the board. Um, it's a great, strong female representation of voices at the board, which again, even though we want to be gender neutral, for so long, women were underrepresented in a field and in leadership in a field where they were the primary workforce. When I look at Montgomery County now with Dr. McKnight leading the county, and Pia leading SEIU, and Jennifer Martin leading MCEA, female leadership up at the top. And I think that's powerful, because it certainly does bring forward perhaps a perspective into leadership that has not been as widely accepted or recognized.
Do you think a all-woman leadership in education in the county, including an all-woman board of education, is going to bring changes to the gender imbalance across the system?
I don't think it necessarily will lead to gender imbalance in this, a gender balance in the system, or correct something. I think what it is, it's a step, right? It's all continued to be a step. What has to happen is that the system that's in place, which is sort of lumbered forward with tweaks here and there, or perhaps a changing the face account of what it might look like and sound like to be a successful system. You have to get into the weeds. And in education, the weeds are usually where people who are looking on it as education as outsiders, that's usually where they want to step back and go, yeah, I don't really care about that. But you have to get into those weeds in order to fix where systemic inequities may exist, and are continued to allow to exist simply because nobody has bothered to taking the time to say, let's stop and rethink this. Let's go back and redo this.
Let's talk about accountability for a minute. It seems that we need a way to figure out good teachers from bad teachers, from good principals from not so good principals. But accountability seems hard to do, not because it's not done, but because it's very hard to pinpoint it.
Well, and the county uses test scores as accountability, and test scores don't measure relationships. Test scores don't measure culture. What we don't do as a county is, the county does, or did for several years, and then kind of dropped the ball a little bit and brought it back. You get a climate survey every year at your school. Students take it, parents take it, staff takes it. And so what we need to do is we need to look at those schools that score low on those climate surveys, because to me, anyway, the key to a successful school is to have a healthy environment. If you don't have a healthy climate based on what you're measuring, what you're talking about, that right there should tell you, well, what do we need to do here? And why do some schools have really strong climates? Why are we not looking at those schools and saying, what is it, and digging deeper, what is it about here that people are happy about, that make people feel successful and feel that all of their hard work, whether they're the parent, whether they're the student, whether they're the staff member, that make them all feel like, you know what, this is my school. I have ownership of this program and my voice is valued.
Do you have any advice for new teachers coming into the classroom?
If a new teacher has made up their mind, has gone through all the training, has come out of their all of their practicums and come out of their student teaching, and is so excited about being in the classroom, then I would say to them, my biggest advice for you is don't lose that excitement. And when it seems like sometimes it's sort of crushing when you're actually in it, remember that you have trained to do this, and there is a network of people around you to support you. I think certainly, being a member of an active, engaged, and supportive union is important. I think making sure that your classroom door is open, so that you're talking to other people, you're talking to and building relationships with not just the people on your team, but people teaching and working at other grade levels, making sure that you're understanding what and working with your building service staff, making sure that you're understanding that you work with your bus drivers, your office staff, that, just as much a part of your classroom is not the person who's teaching next to you, but the person who's working in the lunchroom is a part of that. Understanding what that means, and that it's your great opportunity to help be a part of building a community, to help your children that you're teaching. That's the best advice. And to not be afraid when somebody is hurt, when to not be afraid if somebody disagrees or if somebody is angry, and to be able to listen and say, well, why are they saying this and what can I do? Where can I improve? That's just a part of it.
Are you going to run for school board?
I probably will. I think the reason for that is, as I look at what's been happening, and I look at who's represented, and I think one of the reasons why I appreciate there being a student voice on the board is because student voice should be on the board. And when I look at other members of the board, members of the community that have been parent activists or been involved in different ways, they should be on the board. And then when I look at educators on the board, I think it's one of the reasons why Jeanette Dixon and Mike Durso were so effective, because they were still so close to their classroom and school experience that they were able to bring that to the board. I think we certainly have other people on the board that have had that experience, but the time between their classroom experience and now, the world has changed so much in terms of education in those 32 years that while some things don't change, certainly the joy you take in the kids, the practice in the system has changed. And I also think it's important that there should be somebody who's been in the elementary school, because there have been traditionally, when people have been in on the board, that they've been more middle school and high school oriented. And I think that having a teacher voice on the board that's still close to their classroom experience is important, particularly from the elementary point of view, that's been day in, day out for an extended period of time. That isn't somebody that's necessarily relatively new to teaching, although I think that that's a great lens to have. I think that having somebody who's been doing the job and seen how it's evolved and seen how this county has evolved, both through my teacher eye and through my parent eye, as well as my taxpayer eye, I think I'd be somebody that could bring a lot of perspective that we don't currently have and haven't had on the board.
Valerie Coll, thank you for coming on I Hate Politics. I hope you'll come back when you announce your run for the school board. What lessons can we draw from my conversation with Valerie Coll and Katie Schenk? First, it is important to point out that Hirschman, in his book Exit, Voice, and Loyalty, had described organizations more formally as limited entities with clear hierarchical structure. But Valerie Coll and Katie Schenk are not only interested in the formal structure of schools and health departments, but more broadly about their professions of teaching and public health, which Hirschman does not directly address. What Hirschman did say was this: in certain cases, such as public schools, and I think this argument can be extended to health departments, it might be better for the dissatisfied and discontented not to have an easy exit option, or to have no exit option at all. Because when there is an exit option, the discontented leave and the organization hurtles to greater failure. In public institutions, this is not a viable option, as it might be in the private sector when switching between companies is easy. Both Shank and Coll offer criticisms but remain thoroughly engaged and loyal to their professions. Valerie Coll is even planning to run for the school board to lead the same organization that she worked for 32 years and has now retired from. Second, Hirschman's framework for examining organizational decline and individual responses to it remains as relevant today as it was in 1970 when he wrote his book. Public health has been in decline for decades. But one thing to come out of the pandemic is the greater recognition, always after the fact, of the importance of public health, and the American Rescue Plan is putting $7.4 billion to fix the problem. But Katie Schenk remains concerned about the ability of public health departments to absorb this huge influx of new resources. Schools, too, are seeing a massive influx of resources. And there are questions there as well about their ability to make the most of it in a system that is highly decentralized and resistant to structural change, including with the problem of gender imbalance, which affects both schools and health departments. Third, Katie Schenk and Valerie Coll both display big, important voices of protest that, according to Hirschman, are central to reversing organizational decline. In both cases, we are talking about public institutions that need public support. But since the time Hirschman wrote his book, the balance between what the government does and what the market does has shifted dramatically in favor of the market. Many credit the Biden administration for stemming the 55 years of attacks on government that began with Barry Goldwater in 1964. For the kind of change Coll and Shank want, the balance between government and market needs to be restored. That's all for this episode. Music for this episode came from Seth Kibel, a Washington DC and Baltimore-based woodwind specialist, music producer, and arranger with an astonishing range from blues and jazz to klezmer and reggae. He performs with several bands and is the winner of 28 Washington Area Music Awards. Songs for this episode come mainly from his 2017 album, Seth Kibel Presents Songs of Snark and Despair, which he wrote in response to the 2016 presidential election. I say this in every episode, but I will say it again. I'm very much looking forward to showcasing local talent and especially local music students on the podcast. If you want to share your music on the show or know someone who might want to, please email us at ihppod@gmail.com or reach out on Twitter at ihppod. I hope you'll subscribe and share the podcast as we bring you stories about politics close to you and your home. See you next time.
I scared the crouch, had to foreclose upon his house. The budget's brought to you by number 45 and the latest FN. You never find, you'll never see our misplaced priorities. Hey, where did we go? Days when the cuts came. I down to Mar-a-Lago, baby, playing a golf What good is a boring museum or a sleepy concert hall? They just can't compare, I do declare, to a bigly, a beautiful, magnificent wall. Funding the CDC seems like a waste to me. I've seen enough movies to say when the zombies come, they never save the day. Oh, where did they go? Or where can they be? Our misplaced priorities. Where the EPA can just go away. Who cares about the Chesapeake Bay?